It's Sharpe in the morning. Turn it up. Jim Sharpe, 550 KFYI.
All right, 9 minutes after 6 o'clock. It was kind of confusing yesterday when the news came out that the governor has decided to let Obamacare be the law of the land by not doing a state exchange. But really, how much control did the state have over a state exchange? A lot of people, for a lot of people, all they had to do was point to the fact that Democrats were really mad that the governor decided against a state exchange as part of the Affordable Health Care and Patient Affordability Act. But what the governor's office said is that essentially this state-run exchange is not really run by the state. There's not really a whole lot of control. Thomas Purcell is joining us. Thomas Purcell was one of our amazing bloggers on election night and was part of our blogging panel during one of the presidential debates. And Thomas just rose, that brain of his it just shone big. So we've decided to have Thomas back to, here's the deal, Thomas. I'm a busy guy. I didn't have time to study this whole thing, but you somehow or another just you can download all this in your brain in about 30 seconds and then spew out what it's all about. By the way, Thomas has a great blog. It's thomas-purcell.com, and it's on our blog roll at KFYI.com, keyword search Sharpe. Hey, Thomas, how you doing this morning?
Good morning, Jim. Thanks for having me aboard. As you well know, I was a 15-year veteran of the health insurance industry, so I know a little bit about what's going on. And the governor's decision was definitely the political and ideological one from the conservative point of view. You don't want to get involved in a program which has not been properly laid out or spelled out. But I can tell you that although she's right that the costs to the state of Arizona would be higher to establish a state system, ultimately in the long run, the benefit to the Arizona electorate will be better and will provide a lower cost policy than a federal exchange would. So
you think she's made the right decision in the short term, the wrong decision in the long term?
Yeah, and ultimately as governor, you have a responsibility to the electorate. You have a responsibility to your constituents to provide the best possible services you can for their dollar. And in doing things the way she did it now, you definitely make an ideological and political point, but in the long run, a federal-run system will offer less choices and a higher-cost policy to Arizona citizens.
So since you have worked in the healthcare industry and you know more about this stuff than I do, explain how the state exchange works and how it works without a state exchange.
Well, that really hasn't even been established yet, and I think that's part of the problem and one of the reasons why the governor has rejected running a state exchange system, because the rules are not properly spelled out by the HHS or by Secretary Sebelius yet. However, it's always been the experience of anyone in health insurance or, in fact, anything in government that a federally run system will by nature not offer policies that may be specific to Arizona citizens' needs and probably will be more expensive because they will only limit it to some of the larger companies. It's unlikely that a federal system will offer more than major carriers.
Why is it called an exchange? How does this work so that it's called an exchange?
Well, the exchange system basically is the insurance companies each pool, and again, I'm not an expert on it because the system has not been really established with the pool system. Right. But the concept is the insurance companies will offer pooled policies in the exchange to offer a low-cost alternative to somebody that maybe their health or they have personal issues that would prevent them from buying a low-cost policy on a separate market.
Gotcha. Okay.
In theory, that's how it works. Now, the reality is what they're doing is establishing a government marketplace.
Right. So it's not really it's not a free marketplace, not a free free enterprise marketplace.
The concept is that by pooling the insurance policies and through an exchange system, it will keep costs low because it'll spread the risk across a majority of the insurance companies. But knowing something about underwriting, I can tell you that already most of the major carriers are offering policies at about the same price without going to smaller companies and essentially offering the same product. So the underwriting risk, spreading it out, is not going to have as much of a positive benefit as most people think.
Wow. Would we have been better off, really, in the long run if they would have actually, there's two things. Number one, addressed address the situation of the people who didn't have health care rather than drag everybody into a new situation with which is what Obamacare does. And number two, allow insurance companies to operate across state lines, which you can't do right now. You've got to, it's only Arizona companies can provide health insurance to Arizonans.
Well, as you know, Obamacare does not really address health care costs per se, except in the fact that it's pooling and spreading some of the risk out. The reality is that a free market with open border allowances for purchasing health insurance from other states would have had a far better effect on the actual cost of policies than an exchange system.
It's because it creates more competition.
Right. A lot of people don't know that the carriers are the ones that are in charge of the market right now. I think Blue Cross has something like 50% of the policies that are out there in the individual health market. So that's why when I say spreading the risk around an exchange probably is not going to affect premiums as positively as some people think it might.
Interesting. So if you were the king of insurance and health insurance specifically, that's what would you go with that plan where you can purchase health insurance across state lines?
Yeah, I definitely would. And as a matter of fact, over the years, I've had a lot of clients do business with smaller B carriers that got established in this state in order to get a better policy, more bang for their buck. And most of my clients who have done that have been very happy doing that. But as time went on in the last 5 to 6 years, those options disappeared, and so prices got much higher. Particularly in Arizona. And it also, part of the problem, too, is the options changed. Because there's less competition, all the major carriers can offer essentially the same policy at the same price and still sell their product.
Right. Yeah, kind of like along the lines of car. Well, and this is like car insurance now. If you're forced to have car insurance, which it's always a good idea, and you hope nobody ever hits you doesn't have it. But if you're forced to have it, then everybody's got to have it, and you can just kind of set a price. You don't even have to collude with other people.
Right. And as you know, in the automobile insurance industry, again, I'm not a property insurance expert, but you know as well as I do that even though the law says you're required to have automobile insurance, not everybody does.
Yeah.
A lot of people go around driving without insurance. And that ultimately is what's going to happen with health insurance because of the costs involved. And when that happens, people are just going to start buying insurance when they get sick. And that is when the real spike in premiums is going to be seen.
All right. Thomas Purcell, you can find him at the blog thomas-purcell.com. And once again, that's on our blog roll at KFYI.com on the Jim Sharpe page. Thomas, thanks for getting up early with us. Appreciate it.
Thank you for having me aboard. I appreciate it.
You bet. And if you didn't live so darn far from the station, we might actually have you come in studio sometime.
Hey, listen, I'll make those allowances. I'm up early at 2 a.m. I've got to make the East Coast deadline, so I'll be happy to come down anytime.
2 a.m.? That's earlier than me. That's crazy, man. Yeah, if I'll tell you what, getting up at 2 a.m., if I had a health insurance company, I would not offer you a policy. Getting up at 2 a.m., that's all I'm going to say.
I get up like 5:30.
Yeah, the traffic accident is much lower now.
Yeah, that's true. Thanks a lot, Thomas. Thomas Purcell there. Yeah, he's the guy's just he just said some things that just really just drove home to me how much he really thinks about things during the presidential election. Great stuff. All right, thanks again, Thomas. It's 6:17.